got folks from Wisconsin, where the center is, Florida, Pennsylvania, Texas, South Carolina, Massachusetts, and Missouri. So patient advocates are far and wide and doing such diverse work as patient reps, billing specialists, prescription assistance coordination, case and care management. So thank you all for taking the time today to come out. I have an ambitious agenda, which is often the case when we're talking about a new field. I want to explain a little bit quickly about who the center is and then take you through sort of a little guided tour of the field of patient advocacy and the educational and professional landscape. And then give you a quick tour into what the center is doing. And I really want to encourage you, as Elizabeth said, if you have questions, please type them through it. And if it makes sense for me to answer it during it, I will. And we will have ample time. I plan to present for about 30 minutes, and we'll have ample time then to have questions and to follow up. And my email is available in the last slide for even further follow-up if that's helpful at all. Center for Patient Partnerships, we've been around for 12 years. We were founded by a cancer survivor, and the core of our experience of our program is service learning. We provide free patient advocacy, and we teach about the patient experience through that lens. We then use the patient experience to inform our research and policy, which is really critical to our mission. A huge piece of what we're trying to do is make sure that the experiences that patients have are shared with decision makers. So we think that the relationship between micro and macro advocacy are really important, and we very intentionally named ourselves the Center for Patient Partnerships. We're really about engendering effective partnerships between patients and providers and other folks in the system. We do a variety of things I've just described, and then we really hope over time to put ourselves out of business, that the healthcare system will become more patient-centered, and honestly, that there wouldn't be the need for advocacy or advocates, that advocacy would just be sort of the way the center was designed, similar to the idea of patient-centered care. Patient advocacy is part of the larger health advocacy field. The way we think about it is that patient advocacy is focused primarily on the individual and interpersonal levels, and that health advocacy is focused on organizational, community, and policy law levels. It's a rich field with diverse history and diverse roots, and we're really sort of now at the beginning of the formation of a new profession. And I think that, you know, what we're seeing is very similar to what you'd see in other fields where there's really huge diversity, and we're trying to get a sense at this point of sort of what kind of coalescing might occur. This is an image that sort of shows you about the various levels of advocacy influence. Patient advocacy, again, focuses on the individual and interpersonal levels, and then health advocacy on the macro system level. And the interconnection between these, we think, is a critical component to advocacy. The field is incredibly diverse, as I certainly don't need to tell all of you, just based on who's on this call gives us an idea for that. We see diversity in the sectors, the substance and population focus, the function of advocates, and then cost and payer issues. Very quickly, not surprisingly, we have advocates in the nonprofit sector, the government sector, and the for-profit sector. We have advocates covering everything from financing and insurance, long-term care issues, employment issues, children's health. So again, there's some folks who are very, very, very focused on one area, as some of you, it looks like, in your work are. And then there's some places similar to our center that try to help patients in a real holistic way and cover a lot of different issues that patients have when they're faced with a life-threatening or serious illness. We just are trying to get a handle on and wanting to sort of illustrate here the various functions that advocates provide: education, empowerment, supporting decision-making, helping folks navigate the complex system, tracking issues, acting as a liaison, listening. We know here at the center how important having patients be able to just have someone hear them, hear their whole story, and really affirm the challenges that being a patient in the U.S. healthcare system can offer. There's no clear set guidelines or ideas about costs for services. Some services are provided free by nonprofits, universities, and hospitals. There is sort of a whole movement of private patient advocates charging hourly rates, which really even within that section of this field is really can range considerably. There are also concierge services available for sort of yearly fees, and again, then you see even higher pricing. What we know is that we're not at a situation where there's any very much insurance coverage for anything other than what would be considered internal case management by insurance. We are starting to see, and we'll talk a little bit at the end about sort of what healthcare reform is doing and the movement to have navigators provided by hospitals or by the state or federal government when it comes to health insurance exchanges. But again, we're at the very nascent stages of this. I think everyone on the call represents the various different roles that we see. There are navigators, including community health workers, who are really focusing on access to health care and continuity of care, which is critical. Advocates tend to have a really tremendous variation in the scope of services that they're offering, and again are working in all sectors with varying populations. Case managers often have a discrete set of services that they're providing, and it can really depend on the sector. And then there's a whole movement within professional education to have doctors, nurses, pharmacists, and other professionals incorporate advocacy into their practice, to be aware of the social determinants of health and how they can really impact health, and make sure that they are linking their patients to community resources. So let's talk a little bit about the educational landscape. I know that's something that many of you are interested in. And I want to start by stating the obvious, since what we're going to do at the end of this is share our program. We are an educational provider, so I'm not claiming to be an independent evaluator of the programs out there. And in fact, I'm going to share with you a website of a place called Advo Connection that is tracking them. But what I want to share is that it's very hard to compare programs. It's often hard to determine the content, rigor, and length of study of programs. This is not an apples to apples comparison. There's tremendous variation in the type of programs that are offered, the prerequisites that are required. Some programs you have to have a bachelor's, some programs you have to have an RN, a nursing degree, or specific experience. The subject matter and course of study varies, the location, the style of learning, the length of study. For example, Sarah Lawrence College offers a master's program. That's 60 graduate credits and 2 years of full-time. And then there are certificate programs, and the certificate programs can range from those that offer graduate credits and can be around 700 hours of study to a certificate program that is 100 hours. So it's very hard, I think, for folks who are interested in education to really make a sense of what is offered and what's out there. And the style of learning can be very different. Some are lecture-based, some are interactive, some have service learning like ours, where folks learn by doing, and whether or not they're self-paced or you have a cohort of other students that you move through the program with. What we know at this point, and you'll see on this slide at the bottom that the website I mentioned from Advo Connection, healthadvocateprograms.com/masterlist, that there are about 19 programs that we're aware of right now. There are about 3 programs that offer graduate credits, either a master's or a credit-bearing certificate. There are about 5 programs that offer a comprehensive certificate, and they all appear to be at least more than 150 hours and offer a certificate, and I'm going to in a little bit talk about the difference between a certificate and certification. There are about 5 programs that offer intensive training, about 5 that are shorter duration that are considered workshops and offer continuing education. Some of those might also offer a certificate, but it's 100 hours or less of education. And then there are 2 programs that are offering either an undergraduate associate's degree or sort of complementary education to graduate education. Again, just very quickly, the topics that are covered are really diverse. Some of the educational programs focus specifically on patient navigation or on hospital-based domains of practice, or include the business aspects of patient advocacy. And some are more broader in their approach in terms of looking at both the systemic and the individual advocacy realm. So certification and certificates. So this is a big thing to sort of think about and know at the beginning of a profession. Certification is a credential that is provided by an impartial or third party, usually sort of a professional association. And at this time in the state of the field of patient advocacy, there is no certification. There are, however, many certificate programs that will offer certificates. And in addition to certificates, many programs either can offer continuing education units, either specific to a specific profession, so for nursing, for example, or law or pharmacy, or general continuing education units. And then again, there are 3 programs that also offer university or college credit and therefore have a transcript that notates the certificate. And in that case, the certificate is considered a minor or a concentration. In addition, there is no licensure at this point or credentialing. So credentialing is an educational standard offered by a qualifying third party, usually at the national or state level in an association. And licensure is a government-issued sanction that sort of authorizes or provides permission to practice. It's a legal bar to a profession and is often exists for public protection. And oftentimes there's sort of a test that people have to take to be able to have a license issued. So currently there is no national credentialing body or government-issued licensure for patient advocacy or navigation. I'm sure many of us on the call have crystal balls or tea leaves that we can read. I suspect that it's in the future, and there's certainly some talk amongst the professional associations, which I'm going to share next, but there is no, as of yet, no credentialing or licensing. There are 3 known professional associations, and I am open to any feedback and information that you have about related professional associations or any information that, we've gathered here about the field. So I'm looking forward to our time to talk after this presentation. NAC was formed a few years ago and has recently become a nonprofit, and it's essentially interested for anyone who is interested in the field of healthcare advocacy, but primarily their membership is made up of folks who are private patient advocates providing advocacy services. There is also the Society for Healthcare Consumer Advocacy of the American Hospital Association, and their focus is for advocates working in hospitals. And then there is the National Coalition of Oncology Nurse Navigators, and their group is specifically for oncology nurse navigators. There are also membership organizations and networks. Advo Connection is really tracking the field. They provide that website that has the master list of educational programs. There is the American Academy of Oncology Nurse Navigators, and their membership is open to more broadly than just oncology nurses, to all nurses, social work, and lay and professional navigators. And these professional associations and membership organizations offer conferences, newsletters, ethical codes, so they're really sort of working to move the field forward. There's also a Case Management Society of America for case management professionals. The Professional Patient Advocacy Institute is for practitioners in health advocacy, nursing, case or care management, rehabilitation, or professional planning to become advocates. And then there's the Medical Legal Partnership Network, which is a voluntary affiliation of medical legal partnerships. And those are generally folks with backgrounds in law, social work, and medicine coming together to address the social determinants of health. Again, in this nascent field, we've got 4 different ethical codes that have been created by various groups, several of which were just described. And we have several groups that I just described stating that they're working on best practices, but as of yet don't appear to have anything that's been released to the public. Not surprisingly, in terms of where the field's at, we see some commonalities in the ethical codes, specifically about the relationship of advocate and patient, competency for advocates, focusing on the importance of patient rights, the integrity of the profession, including ongoing learning, and conflict of interest, ethical issues. But we also see some areas of distinction. Discussion or lack thereof around justice and equality, believing in transformational change, recognizing the complexity of the need to value evidence-based medicine, but also recognize the sort of high degree of personal choice that needs to come into decision-making, serving both the individual and the group at the same time, that macro-micro case-to-cause tension and relationship, and the question about maintaining multiple pathways for attaining a credential as we move forward in this profession. So again, very, not surprising where we are at the field, that we've got multiple different organizations articulating their values and, sort of the culmination of interest and discussions beginning. Employment. I'm really looking forward to hearing what folks have to say when we talk about this. Lots of buzz out there about this being an emerging job, whether you're tracking CNN or the New York Times or the Wall Street Journal Market Watch. But the reality is that for the most part, except for folks who have advocacy as a complementary skill that they're coupling with an advanced degree, the jobs are hard to find or not necessarily sort of clearly marked as being a patient advocacy job. Patient advocacy function is really embedded in lots of other jobs, and there's tremendous diversity out there as evidenced by who is on this call. So we know that there are self-employed patient advocates, sort of the entrepreneurs who are hanging out their shingle and offering a variety of services, nurse oncology navigators, patient navigators and community health workers, case managers and patient representatives, consumer assistance program staff offering support for patients and consumers who are trying to make sense of their insurance. These programs are part of the state government. Prescription assistance advocates doing the important work like NeedyMeds, medical billing advocates, and as mentioned before, the attorneys and social workers in the medical and legal partnerships. Monster.com does have patient advocacy jobs posted, so we're certainly aware of what's happening here. And the Institute for Patient and Family-Centered Care has done a survey about patient and family advisors and paid positions within hospitals across the country for advisors or coordinators for patient and family advisory councils, and we certainly would consider that to be those to be patient advocacy jobs. So what does healthcare reform have to do with patient advocacy, and how is this going to sort of move the field together? So there's just three quick things that I wanted to mention. The Patient Bill of Rights, the consumer assistance programs, which I mentioned briefly, and navigators in the health insurance exchanges. Certainly, the fact that we finally have a Patient Bill of Rights codified reinforces the value and importance in patients themselves being self-advocates and the rights of patients being respected, and therefore individuals who are advocates or incorporate advocacy into their work for patients to be able to assert what's important for patients. The consumer assistance programs, CAPS, again, exist in the state government, and oftentimes within departments of insurance or attorney general's offices, and many times states contract with nonprofits. And what these programs do is provide education, information assistance with enrollment in public benefits, appeals of private and public insurance, understanding coverage, consumer rights, and understanding and getting access to the new benefits that were provided by the PPACA. For example, children being able to be covered, adult children being able to be covered on their parents' insurance until they're 26 or 27. And many of the CAPS leaders and staff identify as advocates. The federal government just issued the second year round of funding for these programs, and we at the Center for Patient Partnerships here are finishing up a qualitative research study where we just spoke with a representative of, at this point, 39 out of the 50 states, and 34 states got these grants, and I think we've spoken to 33 of the 34 grantees to get a sense of how these programs are working and what the benefits are for consumers and what's needed to really meet the needs of consumers. Lastly, in terms of healthcare reform, we know that navigators are going to play a critical role in the health insurance exchanges that are supposed to open in 2014 as a marketplace for insurance. And the navigators are mandated to provide public education, facilitate fair and impartial information concerning enrollment in qualified health plans. And the fair and impartial information aspect of that should be underscored, because unlike the advocates in the consumer assistance programs, the navigators are supposed to essentially not be advocates and be neutral, and there's supposed to be a relationship between the navigators in the exchanges and the consumer assistance programs, so that consumers not only have help choosing insurance that's right for them in a fair and impartial way, but then once they have insurance, they have access to the CAP programs and someone who can help them understand coverage, appeal denials if they're having problems with insurance coverage and things like that. And again, that the advocates in the CAPs can act as an advocate and not need to follow the fair and impartial mandates of the health insurance exchange. So what I'm going to do next, I'm going to take a quick sip here, is quickly show you our program. What we have at the Center for Patient Partnerships, and I said at the beginning of our program, we've been educating for 12 years, and we started in a face-to-face manner, and for about 4 years we've been offering 12 credit certificate programs in consumer health advocacy. And we have always, for the last 4 years, had a graduate certificate, which is for students who are already enrolled at the university, either in the law school, social work school, pharmacy school, medical school, and wanting a complementary certificate. And then we've offered a capstone certificate, which historically has been for post-baccalaureate students who are thinking about going on to graduate school and are interested in learning about the healthcare system sort of in their gap year. And we are very excited this fall to be launching our non-credit online professional certificate. All three of our certificates have the same course of study. And I'm going to show you on our website here. Just a second. Mark, can you show me how to scroll? Do I have to use this? There we go. Okay. Here it is. Okay. All right. What I'm going to show you is just give you a flavor for our website so you can find out more information about our certificates. That shows you, gives you a description of the 3 certificates I just described, and then the next section talks about eligibility, prerequisites, and technology requirements. And I just wanted to quickly show you this course sequence here. So for our online professional certificate, we start with an Intro to Patient Advocacy course, and I'm going to show you a little bit about that now. And then the core of our program is learning by doing. So we have an applied advocacy experience where students work with patients. They learn about the healthcare system and they learn about advocacy by providing advocacy to folks with cancer and life-threatening illnesses. And again, this will be available to students all across the country. We will be using Skype and other technology to provide the very low teacher-to-student ratio that we offer to support students who are learning by a service learning experience. We have a database that's available, a secure database available online to keep data about the clients. Then we offer a Models of Advocacy course, which is about systemic advocacy and learning about legislative advocacy, media advocacy, how to take the individual experiences of patients and make change at a broader organizational and policy level. Students can elect an externship if they'd like one, and all students in our program do a capstone project or paper. So since a picture's worth 1,000 words, we wanted to just quickly show you this Intro to Patient Advocacy class. So this is our module on listening, and let me just start quickly by showing you a list of all of the 13 weeks here. So in this intro course, we do an intro to the course and to our model of advocacy, which is an empowerment-based model. We then do an introduction to the field of patient advocacy. So instead of taking 25 minutes, we read articles about the various different roles and make sure people understand the context of the field. We have a learner-based approach, so we do a whole week on independent learning. Then we want to make sure that people understand the healthcare system. And I'm going to show you both modules 5 and 6 on the patient perspective and empathy and communication. We cover end of life, ethics and professionalism, medical decision-making, framing decisions, cultural competency and health literacy, and creative and collaborative problem solving and teamwork. So just to give you an idea of what a module looks like, this is our module on empathy and listening. On the introductory tab, you'll see that the way this course works is it's very user-friendly and tab-based. Every module has an introduction tab, a key concepts tab, a guided practice, resources, and application tab. And on the Intro tab, we introduce the topic, and we provide learning objectives and aspirations and articulate what students will be doing in the module. And then we have a very interdisciplinary faculty, so each week there is a different faculty person who is the content expert that week, and there's a lead instructor for the entire experience. And we want, this is a course that's very interactive. Its students go through as a cohort, and each module is done for a week. So on this key concepts, what we have students doing in terms of learning about listening and empathy is listening to music and posting to a discussion forum, listening to a teenager talk about her experience with her healthcare and discussing that, listening to Evelyn Glennie. I don't know if any of you saw the opening of the Olympics. She performed on Friday night and was phenomenal. And again, sort of, share and reflect upon the importance of listening in advocacy. And students submit an assignment. And then we have a discussion here, a video, and an activity, really understanding the difference between empathy and sympathy. We piloted this course in the spring, and we find that students get lost in it, and it's approximately 9 hours per week, and they have a really engaged learning experience. We wanted to quickly show you the patient perspective for 2 reasons. One is we wanted to show you that one of the things that we were able to do in this class, is have a panel similar to sort of a webinar. We brought in a patient, and our students all over the country will be able to interact and ask questions of the patient about his experience with the healthcare system. And what we offer in all of the modules are resources. So at the end of the course or throughout the entire course, students have access to resources that we've compiled, things to read, videos to watch, books to really support their continued learning. So I think what we'll do at this time is turn it over to Elizabeth to share with everyone, to share with me your questions, and we'll have a discussion for a while. Thank you so much for taking the time to learn about the field of patient advocacy and our educational program at the center.
Thank you so much, Sarah. We're really excited here at NeedyMeds to have you come on and present a little bit about patient advocacy and how important it is, and a little bit about your program. Like Sarah mentioned, if you do want to start typing in any questions you have, please go ahead and do that, and Sarah will answer any questions. While we're waiting for those questions, I did just want to mention that if you do have any questions for Sarah, you can see her information is up on the screen right now. If you have any NeedyMeds related questions, you can always contact me. You all should have received an email from me, but just in case, I'm Elizabeth at NeedyMeds.org, and I'm the Outreach and Education Manager here at NeedyMeds, so just any NeedyMeds related questions, don't hesitate to get in touch with me. And I'm not seeing any questions yet, so we'll give everyone another minute. You can also find out a link to the advocacy program on our advocates page right now, and I would encourage you all to check that out, because that's sort of the resources that NeedyMeds can offer to people working in patient advocacy. So we do have a question here. Is the professional non-credit online program available for those without a 4-year degree? So what's sort of the requirements there, Sarah?
Yes, thank you. That's a great question. So the capstone certificate requires a bachelor's because that's a University of Wisconsin requirement. The professional certificate does not necessarily require a bachelor's, and we would encourage anyone who is interested to apply. I think the way we word it on our website is sort of, relevant professional experience. So I think, we want to have a conversation with anyone who's already working in the field or interested in working in the field and wants additional education.
Okay, there's a question about getting a copy of the slides. I'm sure if they just get in touch with you, they can get a copy of those, Sarah?
Yes, absolutely.
Okay. There's a question about what is the general cost of a non-credit professional certificate?
Yeah, that is a great question. So as if folks recall, there's such diversity in the field and such diversity about what we mean by a certificate. So our certificate is the equivalent of, our non-credit certificate is the equivalent of 12 graduate credits, and we've calculated out the time to be about 680 hours to complete. So it's again equivalent to 12 graduate credits, and our certificate is $7,999 for the total certificate. It's paid in units, so it's paid as students go through. So each course is approximately 3 units, so it's approximately $2,000 per class. There are certificates in the marketplace, and you can check out the Advo Connection list, and I can certainly provide that website again, that are more like 100 hours, and therefore I think, if I was doing my math yesterday, I think there are certificates that are more in the range of $1,500, but you're getting less time for that, obviously, and therefore less continuing ed units if that's something you're interested in.
Okay, thank you, Sarah. We don't seem to have any more questions, but I'll give everyone just another minute or so to see if you do have any other questions. Otherwise, I'm sure if you think of some down the line, you can go ahead and get in touch with Sarah. So I don't see any more. Did you have anything else you wanted to talk about, Sarah, or bring up?
I just want to
thank maybe for the audience.
Yeah, I want to thank everyone for their time today, and really encourage folks to let us know if you learn about a new professional association or a new educational program, and to keep up the hard work. We know how critical advocacy work is for patients, and we appreciate being part of such a rich and diverse and wonderful community.
Well, thank you so much, Sarah. And, we really appreciate you coming on, because assuming you are all users of the NeedyMeds website, you know how many resources that are out there, but it can be very hard to navigate. So just in our sort of small part with the prescription assistance of patient advocacy, we really know that the social workers and the navigators and everything like that really help the patients get access to these programs. So
well, and I want to do a great plug for your website, because I mean, what we know is, unfortunately, for patients, it does take a web of resources and, putting together different financial packages and different nonprofits and different support groups, and NeedyMeds having not only providing what you're providing around prescription assistance, but then to have the resources on your website for advocates across the country to use for the holistic needs that patients have is incredible, and our students use your website all the time, and so thank you for that.
Okay, thank you. So I think we'll wrap up. I hope everyone has a good rest of the afternoon. Definitely check back to the NeedyMeds webinar page for upcoming special topic webinars and the monthly webinars we do that go over our resources, and check out the Center for Patient Partnerships as well. So thank you again for attending this webinar, and I hope everyone has a nice day.